like, why not kind of make it like a nail salon? Like, what's this whole thing of like hygiene has to be part of the doctor visit and all this stuff? And I'm like, maybe this is like a super outdated model.
I saw it. I think I don't know. It's been like maybe a week or 2 weeks since this happened, and then it'll probably be a month out once we actually release this episode. But that Arizona passed that law allowing, they're calling them OPAs, or oral prevention assistants.
Cool.
And basically what it's doing is it's solving that issue that I feel like the whole country's having with finding any hygienists anywhere that want to work. Mm-hmm. So
explain this. Yeah.
So the law basically says that you can train an assistant through, I believe, taking a certain amount of, continuing education hours and all that stuff. And then if they're under the supervision of a dentist or a hygienist, they can now do cleanings. And when we say cleanings, yeah, I know, right? Uh-huh. So when we say cleanings, like no SRPs, sure. They're not diagnosing or anything like that. Okay. But if you've just got a healthy patient coming in for their 6-month recall, yep. Now instead of them having to, the only option of seeing a dentist or a hygienist, they can see these OPAs or oral prevention assistants. So
that's amazing.
I mean, that's kind of huge. I feel like a lot of us have been hoping for that. I mean, it kind of goes back on the whole, this hygiene issue. It's like since COVID, right? It's just been a mess. I don't know. You're not involved as much as like the day to day at the offices, but for us, I
was sick of it.
Yeah.
Sorry, sick of them. I'll have blanketed statements during this whole podcast of just like all hygienists, but that's not true. I mean, we like hygienists and stuff like that, but most of them are pains.
Yeah, I mean
and I've had issues with it prior to COVID, like with just like personality conflicts, and they want this, and then there's all these issues, and then COVID happened, and it just like made it 1,000 times worse.
Yeah. So I mean, at our offices, we're partnered with the DSO, right? So their pitch is that they also have better access to finding candidates, and they have their own internal team that'll do that, right? Which there isn't actually a secret sauce, but we have. First off, I don't, unless I'm just like the world's worst boss, I don't think I've ever been able to keep a hygienist for more than like 8 months to a year. They just constantly rotate out. And in Colorado,
it's all you, Eric.
Yeah. And then in Colorado, there's this big issue of all of them joining cloud dentistry, which is just a platform, and a couple other ones too, but it's just basically a platform that allows them to temp.
Yeah.
Right. So a lot of them are doing that. It's driving up wages. It's really hard to sustain that. We've had ads out because we need 2 hygienists at one of our offices. One just announced that he's moving, and then we just got a new one to start. So for like a day, we had 2 hygienists, which is what we needed. But one's already leaving in a month, and we probably had an ad out for 6+ months.
It's like an ongoing ad. Yeah. It's just like pause, okay, and then unpause, keep it going.
So it's been such a big issue for us too, because we're PPO offices, meaning we take insurances, right, or we're in network with insurances. So a lot of these insurance plans, they're not increasing their reimbursements for what we're getting paid. And at least in Colorado, we're getting hygienists wanting minimum $60 an hour plus. Yep. Probably even like more now. And some insurance plans are paying $60 for the pro fee, for the cleaning. Yeah. For a whole, and then it's a whole hour appointment. So you're pretty much at a wash. And it's just, you're not making any money on any hygiene. So it's a big issue. So
anyway, back to the assistants. So
yeah. So sorry.
Yeah. We'll just do the whole podcast, just you and me just bitching about this. So anyway, we figured we might bring someone on that is very familiar with the whole hygiene situation and how to navigate that. So Dr. Graham Dersley, thank you for coming on.
Thanks for having me, Alex and Eric. Pleased to be here.
Yeah, nice. And Graham probably doesn't fully know, but he did a startup journey a little bit before us, right? And so he was very active on Dentaltown in like the mid 2010s, right? Yep. Which is that's like 10 years ago plus now. And so actually when we were starting with all of our startups, right? Yeah. In like 2017-ish, when we would go on Dentaltown and look, Graham was actually kind of a good inspiration for us on how he did his startups, and we kind of followed his journey and all that stuff.
Yeah, because you had a practice? Did you acquire one and then also doing a startup? What was that backstory? Yeah.
Yeah.
Because I was like, that's like me. That was like my situation. So I like followed everything that you said to like a T.
Yes. Okay. Yeah. I acquired a practice 1 year out of residency. I did a prosthodontics residency. I bought a small practice, and I had that for about 4 years. And then I did a startup. And then about 9 months later, I opened a second startup and then sold the original one. So down to the 2 startups.
Yeah.
And just the idea with that was I had the small practice. I was working that. But I thought having a couple bigger practices with like multiple dentists could be like a good internal referral network for my prosthodontics cases. So that's kind of how that worked out. That was the strategy with that.
Yeah, is that? I mean, how did that turn out? Did it go according to plan?
Pretty good. Yeah, it pretty much materialized as needed. Now, with many years of building that up, right, it didn't happen like overnight, but in the end, after like a few years of working toward that, it was.
Oh, nice. Yeah. That's awesome.
Yeah. So thanks for all the guidance on that of sharing your story, because I'm like, what do I need to do? And I'm like, print off a page of like the how to, and I'm like, okay, this is what we need to do to like build this up. Yeah. So that was really helpful. But you kind of have like a new playbook right now.
Yeah. Well, what happened? See, when I first started these practices, I very much was using the old traditional playbook of, just market broadly, get as many bodies in the practice as you can, which as a startup, it kind of makes sense. You have nothing to begin with. So you take anybody you can. You want to build up hygiene, get, 2 or 3 hygienists working, lots of volume of patients, add associates, add hygienists, add associates, just keep going like that. But if I could do it over again, I think I'd do a different strategy, actually.
Okay.
Because and back then it actually worked much better than it did now, because I could hire hygienists for maybe like $40 an hour.
Yeah.
We'd put an ad out. There would be, a bunch of people applying. It wasn't the same situation we're in now. And when you take insurances, I was looking back then, 10 years ago, they paid almost the same as they do now for the procedures, right? I mean, things have barely moved on the fee schedules. And so we could make it work. I mean, the overhead wasn't so bad. Staff wages across the board were down. Everything was cheaper. And so the fee schedule wasn't so terrible. And we could just sort of rely on that. But then over time, what I started to do also is learn a little bit about marketing and learn that, there's one way to bring patients in for diagnosis through hygiene, right? We're hoping we bring in patients for cleanings. We hope that they need something else. We hope they need a crown or whatever.
Yeah.
But it takes a lot of convincing sometimes, because they're there for their free cleaning, and you tell them you need a crown. That's bad news. They don't like that, right? Mm-hmm. So it's much better, I find, to see a patient who comes in and they're like, I have a problem. I've got these 5 broken teeth. I know I've been putting it off for years, and I'm ready to do something about it. I know it's going to cost a lot of money.
Yeah.
Yeah. Well, I know we always loved, like with marketing stuff, like you said, when it was marketing towards like the emergency patient, right? Because it's very simple. Like they're coming in, they know they have a problem, and you can just solve that problem. And so
it's perfect. And even like you were saying too, the ones that have been putting it off forever, they already have that huge number like in their head of like, oh, this is going to be like $50,000 to like, whatever, they've dreamt up and like ruminated on it. Like, and then sometimes when you say the actual price or tell them what it is, it's not as bad. So it's like working the opposite way. Yeah. And just like, it makes all of our jobs so much easier to not have to spring all this bad news. Like, oh, I noticed these cavities that you never knew you had, right? And
and they don't hurt. So
and then trying to prove it. Here's the picture of it, and you skip all that. And what it does too, it makes your exams so much more efficient, right? Like you can diagnose. I checked this last time I checked. My production per exam, that ratio is like $2,000 per exam done.
Oh, wow.
Yeah, nice.
And that's mostly because I don't check hygiene anymore. I just get the referrals from my other dentists. So I'm basically only seeing exams for patients who have problems.
Okay.
Perfect. Yeah.
And want to fix them, right? So then what happens is half your day is not consumed by exams. You can just do more dentistry, actually.
Yeah.
So,
Oh yeah, because I know we got into an issue at least the last year where because hygiene was so hard and it was hard to find anyone, and our practice was built on that model, like you said, right? Like a lot of us went into that family dentistry model, like you said, where you bring them in and then you're seeing everyone, and a lot of that is built through hygiene. I mean, I became a hygienist, and it was so frustrating because I'd look at my metrics, and I'm like, these are awful. Like I'm probably the worst producer in Colorado right now. Like it's bad. And then I look back and I'm like, because my schedule is so full with hygiene, and there's not even gaps to put in any kind of treatment. So like I was still, that was the issue. Why it was kind of that like you have it set up as yours is like escaping hygiene hell. For me, that was like a personal hell because I was busy with just doing hygiene, and I was still booked out like 2 weeks, but I couldn't even see patients. So then it was hard to get like same day or do any of that. And it became this cycle that was just awful. So yeah. So tell us, go into more detail on what you guys do and how you guys are like escaping hygiene hell.
Well, so a lot of it is changing the marketing message. So if you go to most dental marketing companies, the thing about it is they know their job is to bring you new patients. And they know dentists are going to look at how many new patients they get. And that's going to decide whether they get to continue hiring the marketing company or not.
Yep.
And so they go for volume, which means the most common procedure that patients may want might be a cleaning, and they might offer a discounted cleaning to try to get more coming. And so the marketing message sort of puts you into that reliance. Now you have to offer lots of hygiene to accommodate all this demand that you are artificially creating through your marketing anyway.
Yep.
And so we decided to do the opposite. And instead of that message, we changed the message to, do you have broken and missing teeth that you are embarrassed about?
Okay.
Or are you in pain?
Yeah.
When you go to a restaurant, do you like tell your friends, no, I can't go because you're worried your teeth are going to fall out while you're trying to eat a meal?
Yep.
And there's so many patients out there who've been avoiding the dentist for years and years. And when they see these postcards come in the mail with these smiling families, all with perfect teeth, and this message, come in for your cleaning, their concern is that they're going to go in, they're going to be the worst patient that dentist has ever seen.
Yep.
Yeah.
That
They're
does
going to
happen.
get a lecture.
Yeah.
They're going to
Very
get a
good
lecture
point.
about it. You've missed 20 cleanings now, and it's all your fault. And now we can't do anything for you. So just get out of it.
Yeah. And Graham,
Good
so
point.
like it probably happens to me like once every couple of weeks where I have someone and their teeth really aren't even that bad. And they always come in, they're like, I'm like the worst patient you've seen, right? And they have
Yeah.
like maybe 2 missing teeth. So yeah, that is true.
Yeah, that perception of like, that's not for me.
Yeah.
That's I've never actually really thought of it like that, but yeah, I mean, I've gotten those patients too, where it's just like they're bawling, and like they've actually had the courage to like come in, but there's like a handful, way more patients that didn't actually pick up the phone to call.
Yeah.
Yeah.
All right, continue. This is good. Keep on going.
Well, and so one of the things we put on our ads is we promise no judgments, because we want to lower that barrier for these patients who most dentists don't even know exist. They don't talk to them. They're not marketing to them. So the perception that most dentists have of all the patients out there in the world is based on the patients that they see in their office. But that's just such a tiny subset of the actual general population. In fact, there's this statistic, half the patients don't see a dentist regularly. And so rather than ignore that other half and say, oh, they don't see the dentist, they're a lost cause. Well, we really lean into that. We want to be the one dentist in the whole county that is trying to get those patients. It's like a completely different pond that we're fishing in. We don't want the overcrowded, You got the one pond over here with all the dentists trying to fish it with the healthy patients who want cleanings. You got this other pond just down the street loaded with bigger fish that no dentists are fishing in. So we just fish in that pond instead.
I love that.
Yeah, that's super smart. That concept of just like
doing different.
Yeah, doing different, or like the opposite of what others are doing, or like you saw an opportunity where there's a saturated area and you felt confident that there was another subset that wanted that, and it was like, well, no one's marketing to them. Let's market to them. They want help.
Yeah.
Yeah.
Yep. And so what we have then is it's just another stream of possible diagnosis, right? If you think of it as a business and you have your different sales funnels, right? You've got on one side, patients who come in not interested in cleanings, but in deferred maintenance. They have broken, missing teeth, pain, and you've got those ones you can do exams for. And then you've also got, we're not completely like getting rid of all our established patients. We have those patients too. So it's just an extra set of possible revenue production dentistry. We're not completely relying on periodic exams to fuel our dental production.
One thought that went into my head was, obviously now you're marketing to different types of patients. Is that marketing cost, have you kept the same marketing costs? Is it more expensive to acquire those patients that you're talking about? Is it actually cheaper? Like, can you go through that?
There's a couple things to consider. Now, the expectation will be a lower volume of patients. The more targeted you get, we're looking for patients specifically who are, our demographic would be a little older, be patients with known dental problems, and we're targeting a higher income also. And so our cost per new patient is going to be higher. Okay. And we're going to plan to see less of them. We're not getting 100 patients with broken and missing teeth a month, but we're getting enough of them that it actually, our overall production per marketing dollar is going to be much higher.
Well, yeah, because I would think I would think the lifetime value of that patient is a lot higher than just a hygiene patient, right? So it's costing you more, but instead of getting a patient who just needs cleanings, you're getting a patient that needs $5,000 in work. So it's okay to spend a little more because your top line is going to be a lot higher.
Exactly. That's exactly the point. And here's the thing, though. Each patient costs you more money. So you have to have better systems in your practice, because every time you make a big mistake and lose a new patient, or you blow your case presentation, or you whatever, you don't schedule the patient when they call, your team blows the new patient call, all those mistakes become much more expensive too.
Oh yeah.
So the team training, the new patient process, the case presentation, the financial presentation all become higher stakes. You're presenting $10,000 cases. So that's key. A lot of times when you have, let's say you have a new grad associate, right?
Okay.
They actually may be the type of dentist who's better off seeing 100 hygiene exams compared to 5 broken and missing teeth exams.
Yeah.
Well, that's Eric still.
Yeah, that's still me. I haven't gotten out of that phase yet.
Yeah.
No, but I get your point on it. Yeah.
No, there's definitely some skills that you need to, not even just clinical skills to be able to treat those patients, but how to talk to them, how to sell them on certain things, consequences, benefits, that kind of stuff.
Yeah. Well, yeah, it's good to get, like, when you're a new grad, you're trying to get your reps in and just get more comfortable in talking. So it's probably better when it's not a huge case too, even for the patient, because the patient needs that treatment and they probably need someone who's confident, right? Like, my point is, if I'm coming in and I have a bunch of broken teeth, I'm probably going to want to see someone who's done it a bunch, who is really confident in it, versus if someone needed to fix a cavity on my back molar tooth, right? And it was just one thing. So yeah, I think you need to get dentists in who maybe have a little bit more confidence in how they're diagnosing and can do it.
Yeah.
Yeah, so this strategy it's a lot involved to it beyond just the marketing, because your marketing is going to do one thing, And it's going to increase the number of interested leads who may call your practice. Okay, that's the top of the funnel there. Your ad is going to generate a phone call. That's it. Beyond that, it's completely up to you to convert that. You've got to convert that phone call into a consultation. You got to convert that consultation into accepted treatment. And then you have to be able to provide the treatment. So expanding your clinical skills is super important, because if these patients come in, they need root canals, they need implants, and you're referring all that out, that patient becomes much less valuable.
Yeah.
Right. So you're paying lots of money per patient. You want to be able to provide the value there.
So this works when you've got like a super GP practice, right? When people refer to that as almost like, well, you're a prosthodontist too, so it's a specialist. But like if, I don't know how many prosthodontists there are here in Denver, but I can probably count them on like one hand, right? It's not like a huge specialty. So for people who aren't prosthodontists or aren't specialized, right, and are like, yeah, this model is sweet, I don't have to deal with hygienists, would you just suggest that you go out and take a lot of CE and kind of become that super GP so you can keep all that stuff in house?
It's definitely, I think, a good way to go, because it's just an easier path, right? The more you can offer, the more potential value each of those patients is going to have for you. So you may need half as many new patients if you can provide a broad range of procedures. If you have a super anxious patient who comes and you can do some sedation to treat them, then that's a patient that's very valuable to you. If you have to refer them out to someone else, that patient just wasted your time in the exam. So those are the things.
And I think too, sorry, I'm going to speak over you again, Alex, right?
No,
but like personal story, right? When we were building these practices, Alex does more procedures than I do, right? Like she'd do sedation stuff, she'd do thirds, you dabble in with implants, do some endo, pretty much like the stuff you should be doing. And I just
like a dentist.
Yeah, like I love buccal pits. That's my thing all day. But so my point is I knew that I probably wasn't going to be that. But then you have a decision to make. We were kind of plateauing in production, because it's like you can only do as much as the dentist is able to do. So what I decided to do, instead of actually learning the skills and being lazy, I just hired other associates who like to do that, right? So I still think
even before that, you hired
would just force
me.
you to do it.
Yeah. So it doesn't necessarily mean like we're not forcing you to love root canals and go and get CE and do it. If you don't love it, then don't love it. Who cares? But have someone in your office that can do them. So that's what I was to Eric. Like I would go into his office on a day that they were closed, and I would just see extractions, implant consults, like all that kind of stuff. We did sedation, root canals a couple times. And I would come in and do that for him to keep it in-house.
Yeah. So I think the problem is, how do you keep the things in-house? And the solution is there's multiple different solutions. You either learn it yourself, and if you don't want to learn it yourself, you solve the problem, find someone to do it for you.
Yep.
Yeah.
Yeah, this is great. I mean, good point. And there's so many different routes you can take to have a successful practice. So that's key is knowing yourself, knowing your strengths, really diving into those. And, your strength may be just as the leader of the business. Maybe you just don't even practice and you hire everyone you need to fill in those pieces.
See, that was the plan for me. So what do you do with patients that need hygiene?
We still have hygiene. We have 6 dentists and we have 5 hygienists. So that's a lot of hygiene still.
Yeah.
Yeah.
We haven't kicked anybody out of hygiene. We have drastically dropped insurance participation, though, which has really cut our hygiene demand, which is helpful. But I ran into this problem at one of my offices. The smaller of the 2 offices has 6 operatories. And we were just growing and growing. And hygiene was up to taking 4 of the 6 operatories. Wow. And with no end in sight, like we could just do as much hygiene as we wanted because it was all free and everyone would just come in and do it. But it limited our dental capacity then. And so we had to just make that decision. We're actually going to consciously cut hygiene in this practice. There wasn't really a way to add on to the, add more operatories there.
You don't want to do 24-hour dentistry?
Yeah, I mean, we could do split shifts and all that. But we just cut it. We do hygiene out of 2 operatories there now, and the other 4 we do dentistry from, and that just increases your production per operatory by so much. And we were starting to plateau, and that kind of broke us through because we can become more of a tooth fixing office rather than primarily a tooth cleaning office then.
Hey, quick break here. If you're enjoying Just a Couple Dentists, don't forget to follow or subscribe wherever you're listening. It's the best way to keep up with new episodes and hear us argue about dumb stuff and complain about dentistry. And trust me, you don't want to miss that. Now back to the show.
Yeah.
Yeah, that makes sense. You should share
my
your
plan, my thing. So this has been I've had this like idea for a long time, probably like after COVID, but just with the whole hygienist issue and stuff like that. And it's not like super planned out. I don't have like a business plan, 300 pages or whatever. Like it's just kind of like something that would be kind of cool to do. We can't do it yet because for legalities,
there's some,
we can't actually do it. But as soon as we can, as soon as there's something that passes in Colorado or really any other state, I mean, the assistants being able to clean teeth is like a step in the right direction. But if we could do this, and this actually goes back to someone, I don't know if it was like a consultant or a speaker or someone had said this before, but you've probably heard this too. You can't treat like your hygiene program like a nail salon, right? I don't know if you've heard that before, where they like dictate what you want. They come in whenever, they don't make an appointment, they can't, whatever it is. And that's always kind of stuck with me because I've thought, well, why not? Like, why not kind of make it like a nail salon? Like, what's this whole thing of like hygiene has to be part of the doctor visit and all this stuff? And I'm like, maybe this is like a super outdated model. So now that we're moving into this direction of assistants being able to clean teeth, step 1, excellent. So what if we completely separated hygiene from clinical, and you have you can share the building, share the operatory, not operatory, share the space or keep it separate, whatever. But they're pretty much how I envision it is like side by side. You have your clinical side where the doctor does treatment, and then you have your hygiene side. So like your hygiene studio, your dry bar. Like if you think of it like a lot of other sectors.
And so, hey, for the male listeners, dry bar is...
Dry bar is like a place that you go to to get your hair blown out. Like they just dry your hair. They don't cut. I don't think they color. That's all they do, just blow dry your hair and like style it. So if you want to go get your hair cut, you have to go see your stylist or Supercuts or whatever you go to, right? So they're completely separate. This would be the exact same thing. Your hygiene side is like someone calls to make a cleaning appointment and they answer the phone and you go on that side. You do not need to see the dentist at all. Your assistants are trained to clean the teeth, floss, polish, apply fluoride if you want, do whitening. They can talk about products. They can't diagnose, obviously, but they can see red flags. They can tell if your gums are bleeding. They can tell if there's issues. And they can say, hey, just like when I go get a pedicure, if I had an infection on my toe, they might say, hey, you might need to go, to the doctor to take a look at that, right? So there's no like conflict there. It's just like, hey, you should probably go on the other side and like make an appointment for your exam. So now, since that's completely separate, the doctor can now just focus solely on doing the exam, x-rays, everything they need, the whole exam, and say, this is what you need. I don't care if you get cleanings once a year, twice a year, 4 times a year, whatever. Go do your thing. If you want it multiple times, go ahead. You go get your cleaning done. But I don't care. I'm making your mouth healthy by doing the fillings and the restorative, all the things that you need. And if you need SRPs, I'm diagnosing SRPs and I'm keeping that on my side. So I can do the SRP. Done it before. I'm super fast. Not a big deal. We can either do it like that and not have a hygienist at all in this model, or if you do get busier and there are a lot of SRPs, then you have the hygienist and that's all they do is just SRPs. all day. They don't do cleanings because the assistant's doing the cleaning. And you've already done your exam, everything's diagnosed, and that's just how it is. And I don't know. Until we can figure out a way to like, because I think there's something where you can't do a cleaning unless it's diagnosed or something stupid.
I think there's some stipulations on it where it's like, or it's under supervision of something, so you'd have to keep them in the same
and it's
office,
like, sorry, well, if I go get a facial, like I don't need my dermatologist to give me the thumbs up. Yes, you can get your facial. Or like my doctor has, yes, you can get your massage. It's like, no, why are we tying this all together? It's kind of stupid.
And I don't know if every other country is like that or if that's just more of an American thing. I don't know if like the rest of the world does this, but I don't know. What are your thoughts, Graham?
I like the outside the box thinking. To me, this reminds me of podiatrists, right? So you don't need a podiatrist to get a pedicure, right? Or if you want like the calluses scraped off or whatever, like, and so I could see it like being, okay, so a prophy where we're just simply cleaning the teeth could no longer be necessarily a medical procedure, right?
Yep.
You could just go anywhere and get your teeth cleaned. And patients would then have to know, okay, this isn't like a medical procedure. This is just cosmetic or it feels good, kind of like a massage or whatever.
Yeah.
Or like whitening in a mall, right? Like that kind of a thing. Yeah.
Yep. And then the dentist would then be in charge of like you say, you could diagnose and say, okay, your gums are healthy, you don't have periodontal disease, and prophy is appropriate, or they recommend SRP or whatever, and then they see the dentist for that. So, yeah, I could see that having legs.
I know. So it's like, and you have like, I get caught up on like branding and stuff like that. You have it like really cool on like the hygiene side. It's like modern and it's like not judgmental or anything like that. It's just you come in, you can walk in. Who cares? Like who's available? Okay, you wait 20 minutes and who's the next person to do your cleaning, and they talk to you about stuff. And the thing is that in this model, it's fee for service. So
the hygiene part.
The hygiene part. Yeah. The hygiene part is you could submit your claim for you, but it's a flat fee. It's like just like getting your nails done. It's like $70. So you gotta upgrade this for the whatever massage. Okay, that's $100, whatever. It'd be the same thing. You get your cleaning for $120. We'll submit your insurance. You can get reimbursed directly. If they pay for it, great. If they don't, well, that's your insurance. That's your problem. That is not an us thing. Doctor side is obviously a little bit different, just because obviously for treatment and stuff like that. But yeah, I don't see how that could be.
Because then you're kind of killing two birds with one stone, because you're getting your practice becomes the like Graham's, where they're coming in focused, treatment. They have problems, and that's fine. And then you're still solving the problem with the people who just want to come in for hygiene. And then if anything's noted, or they want to get an exam, or they notice the patient has really bad breath, or they see calculus, right?
Yeah.
Then it's saying, hey, I can't solve this now. You should still get this done.
Yeah.
And then you're pre-qualifying them to go to your practice to get actual
exactly.
work
There's
done.
like a funnel right from the hygiene side coming in, and those are people that probably don't want to see a dentist. They're like, oh, I gotta see the dentist again. Like nothing's wrong with my mouth. I just want clean teeth, kind of thing. So I think the barrier gets low.
Are these hygiene salons allowed to practice independently? Are they always associated with an office?
I think under this model, it is associated with an office, just so it could share a space, share front office staff.
Because I think so in Colorado, I know you can be a hygienist and have your own studio. And from what I've heard, those have like epically failed, just because reimbursements we know aren't high with hygiene. And a lot of people don't want to come in just to see a hygienist, and there isn't an opportunity to really see a doctor. They have to travel somewhere else and do anything. So if it was almost connected and it was like an extension of the practice.
Yeah. And I've like...
Or you brand the hygiene
just like
part
how like medical spas kind of are. Like sometimes they are combined with like your dermatologist. So like, okay, you want to see a dermatologist, get your skin checked out, make sure everything's fine. But if you want your Botox and your filler, that's like down the hall. Like you see like a different section.
Yeah, it's almost like an oral health center, right? And it's kind of got
but like way cooler. Yeah. But cool. So I don't know. I just think that would be, as soon as like we are allowed to do that, like someone needs to call you up. Call me up and we'll do it, because I just think that's what we need to do. It'd be really cool.
I mean, you kind of could almost do that now, like just make the hygiene way cooler, right? Like just have nicer atmosphere, music playing, like, um, you know, less medical. Um, uh, Maybe that's a possibility even now. I don't know, except the labor side of it's the only wrinkle
Yeah,
there.
yeah. So
You would need to
I need
have
the assistants. I
assistants
need
to
the
be able to do
assistants
it. Yeah.
because, like, money wise, it works. Like, you pay your assistant like $25 or an hour,
You
whatever
probably pay
it
them a
is.
little more if they're
Or a
doing
little
that,
more,
yeah.
or whatever it is. But then, I mean, that just makes
Well, yeah,
so much sense.
then it resets it to like what Graham was saying, like to like pre-COVID when you could get hygienists for $40 an
Yeah.
hour and it was fine. Like it kind of worked, but you kind of have to shift the model a little bit with pricing, and that's what some states are doing.
Yeah.
I mean, yeah, I'm excited to see once luckily we don't get a lot of viewers. Otherwise, if we did, you'd probably get destroyed after this gets released by all the hygiene associations.
All the haters.
Yeah.
Well, sorry, too bad. You guys made it bad for yourselves by like not playing along with us.
Yeah.
But yeah, I don't know. I think that would be kind of cool to do.
As far as the hygienist, I know like a lot of dentists are very annoyed about the labor situation and like how, they're asking for a higher salary now. But I kind of see it almost a little bit differently in that, I think a lot of dentists who are so hygiene heavy are a bigger part of the problem than even the hygienists because they're the ones willing to lose money on hygiene. They're the ones that are hiring a hygienist at any cost because it's their only way of filling the dental chair. And they're just so like committed to these periodic exams, and having to have like 3 hygienists per dentist to
Yeah.
make their practice model work, that it like artificially spikes the demand for hygienists when there's a low supply. And that's a big part of also why the wages are so high. Like if more people would adopt the tooth fixing practice first approach,
Yeah.
then we could have more like 1 hygienist per dentist. And I think that would like almost solve the problem right there.
Yeah. Yeah, it would.
Yeah.
I think it would.
Yeah, I think so. But then, yeah, you're right though. If you you would do that, but then for the overflow and the people, like if everyone adopted that model though, Graham, then you'd probably have would you have then a shortage of hygienists or people that would to serve the people that just need like hygiene, and that's where like an assistant could come in and kind of fill in that role.
Here's what would happen.
Okay, yeah.
More dentists would be able to drop insurance because they have to have insurance so they can get enough hygiene patients to do enough periodic exams.
To do enough treatment yeah.
We're fixing more dentists would drop out of insurance. Patients would have to start paying out of pocket for their hygiene, and the demand for hygiene would fall. Right?
Yeah.
And so there'd be fewer patients needing hygiene, and so you wouldn't have that issue. I don't think there'd be any like you're not going to have like millions of patients who just suddenly can't get their cleanings. I don't see it happen. If more dentists.
And I mean, but okay, so like when I was in the military, right? They didn't have enough hygienists, so the standard of care became these, and it was usually younger people, right? So that were in the military, that they would only have to be seen once a year for hygiene. So like I know we were listening to one of like Alan Mead's podcasts when he was talking with some guy in England, right? Maybe it's like Jason Smithson, I think maybe. And he was talking about how his model is it's not set to where in England you have to see a patient every 6 months. If someone's really healthy, you can diagnose them coming in once a year for their cleaning or every 18 months. Like if someone's 50 years old, never had a cavity, gums look perfect, never bleed, do they have to come in every 6 months? Are you providing a substandard of care if you tell them their prescription is once a year?
Real quick, if you're into what we're talking about and want more, check out my newsletter, Just 2 Minutes. It's the dental blog you can actually read between patients. No fluff, no BS, just straight up tips, stories, and insights to help you level up. You can subscribe over at coupleofdentists.com or just hit the link in our show notes. Now back to the pod.
We pretend like this is a medical necessity, but it goes back to toothpaste ads in the 1940s or whatever.
Yeah.
That initially started recommending seeing the dentist twice a year, followed by that being what insurance pays for.
Yep.
You think if insurance paid for 3 times a year, then all of a sudden we'd be saying you need 3 times a year, right?
And the
Yeah.
patients would
Yeah.
say that.
insurance
How many
money.
times do you get patients too that are like, I'm going to come in twice a year because I want to get my benefits. I get my 2 free cleanings. Like that's one of the most common things you hear people say. They don't know if they need 2 cleanings, but they get it. So it's like you lose it or use it or lose it, right? And so yeah, that is interesting.
Yeah, I mean, if they started paying for 1 cleaning a year, I mean, most patients would get 1 a year, right?
Yep. Yeah.
Well, I mean,
Absolutely.
think about perio. Like one challenge in a dental office is perio maintenances, right? Because a lot of insurances won't cover for a year, and if someone needs 4, how many times did you get patients that would say, I know you're telling me I got to come in 4 times a year, but I can't pay those 2 out of pocket. I'm only going to do what my insurance covers. So yeah, I mean, I guess this goes back to like insurance sucking, but yeah.
Yeah.
Well, and also just us, really, it's a crutch that we've started to rely on too much, being insurance. How many practices like have this habit of making treatment plans up to the annual max for the patient, and then recommending that, and then saying, okay, next year then we'll do this next set of treatment because then it'll go up to your annual max
sure.
for that year.
Totally. I think that's how we're all taught. Like I mean, I don't know, you look at open dental and then you see under your 4DO filling if it says over annual max. I'm sure a lot of dentists like get gun shy, right? And they're like,
yeah, we can wait 6 months for that one.
Yeah, it's August already. I mean, I've been guilty of that. It's like, you think like, oh, it's August and I know this patient only wants to use their benefits. Like, let's just wait till the new year. And it kind of affects how you would diagnose, which is not a good thing.
Yeah.
Yeah, I mean, why not just tell the patient everything you need, not need, most things aren't necessary in dentistry, but give them a complete treatment plan, and just see if they're interested in that. And if it's $15,000 and they say that's too much for them, then you can walk that back and phase things. But the idea of them accepting a $4,000 treatment that's within their annual max or whatever, or 2,000 or 3,000, becomes much greater when they're comparing it to the $15,000 ideal plan that you suggested, first of all. So I don't see any reason why the dentist shouldn't initially give the patient the best option and say, many of my patients are interested in getting their mouth in tip-top shape, and this is what it could look like for you. You're not hard selling that. You're not insisting on it. You're not even presenting them a formal treatment plan, but you're just giving them the information.
Well, yeah, and Alex, you mentioned this earlier.
Yeah.
So like she had another idea too, and I don't know if you guys implement like something like this, Graham, in your office, but the whole point you said where you have someone beforehand tell you where they want their mouth to be.
Well, that's the thing. Like in the scenario we just described, it's like, okay, I'm going to tell them what, this $15,000 treatment plan, and maybe they want it, maybe they don't. Why are we guessing? Why don't we know beforehand and go, Susan in the chair, where do you want your mouth to be? Like, are you interested in like just bare minimum? And like, I like visuals, and I think a lot of people are visual people, and especially in the mouth, no one can actually see what's going on. So it's like, let's look at this spectrum here of like really bad teeth, better, getting better, and best. Where do you want to be? This is not a today thing. We don't have to get it fixed and, by tomorrow, but where do you want to be? And if you want to be there, well, guess what? That's that $15,000 treatment.
And they've already told you that's where they want to be.
So now we're not guessing on stuff either. And if they're like, no, doc, I'm okay with my teeth looking like shit here. And then you're like, okay, well, then I'm going to tell you what you need. But just know that this is like, we can do a couple of these at a time or whatever it is. But like, no one's going to want to pick that.
But then
right?
that hits that influence principle that we've talked about too, where like they've already told you, and people don't like to walk back on being like a liar, right? So if you tell them beforehand, where do you want to be? And they've told you, I want my mouth to look like this. Well, when you give them that option, people don't want to feel like they're liars, so they'll accept it. Which and obviously you're doing everything ethical and you're actually presenting what needs to be done, but you've almost kind of gotten them into a situation where now they're hopefully more likely to accept your treatment because they've almost told you what they want. So I don't know.
Yeah, exactly. And we all develop a little bit of a dialogue that's comfortable for us to deliver to the patient. And so for me, the way I do it is I ask the patient, I talk about other patients that I've treated before. So I say, like, many patients that I see who have mouths similar to yours and similar conditions really like to go for the ideal, which may be replacing all the missing teeth with new permanent teeth, making all the teeth look very nice, a great smile. And just so you know, the price range of that would probably be around the $30,000 range. Is that something that you would be interested in? Right? And it just kind of, it acts as an anchor. You talked about influence principle.
Yep.
And some patients will say yes to that. I've done lots of cases like that. And if I'm not willing to mention that that's a possibility, then you don't do any of those cases, right?
Yeah. Right.
But what dentists fear is that they're going to mention this number and the patient's immediately going to get up and leave the practice and
leave a bad review,
say you're too expensive, and write a horrible review. But the thing is, we're working with the patient. So when the patient then tells you, actually, that's beyond my price range, you get to then become the patient's advocate. And you're going to work with the patient to find something that is more suitable to them. You're going to work with them to just find a treatment plan that meets as many of their goals as possible within a price range that is workable for them. And so we start with the most ideal plan, and then we'll maybe offer a compromise plan. Maybe instead of the implants, we're going to do a partial denture, but they still need 4 or 5 crowns and some fillings. And that's going to be, fortunately for them, it's going to only be half the cost of that ideal plan with all the implants. And to them, that's a little bit of a relief. Now you're giving them good news that, like, this treatment plan is so much more affordable than what it otherwise could be. And when patients have good news about their treatment plan, they're not going to all of a sudden like look for some kind of escape hatch to try to get out of it and pay less. So oftentimes they like to pick an option that's like not the most expensive, but something that's a little bit more medium in price. It's kind of like when you go to the movies and they have that big, medium, and small bucket of popcorn. The medium one is the one that sells the most because it seems like a better deal to the patient.
Well, Graham, we appreciate you coming on. I mean, obviously, it's cool for us to have you on because you indirectly helped influence us because we followed a lot of your stuff from Dental Town. So thank you for that. We appreciate that. And we'll have to try out Alex's model in the near future. And I mean, Graham said maybe it's doable. So maybe you can start it out.
We'll team up. So, we'll do our new model, and we'll have these cool hygiene studios around town. That's cool.
Good.
Thanks, Graham.
All right. Well, enjoy the rest of your day. See ya.